The title of today's presentation is Malnutrition and Diseases. This presentation is a continuation of the previous presentation where we explore the various forms of communicable and non-communicable diseases. The learning objectives of this presentation is: one, for the student to be able to define malnutrition and classify its major forms, explain the two-way relationship between malnutrition and diseases, differentiate wasting, stunting, underweight, marasmus, and kwashiorkor, identify various micronutrient deficiency diseases, causes, signs, and prevention, and lastly, to be able to describe methods for nutritional assessment and prevention strategies. Now, to start with, what is malnutrition? What is nutrition? And why nutrition matters? Now, nutrition is the process by which living organisms obtain and utilize food substances for growth, energy, repair of tissues, and maintenance of health. Therefore, good nutrition is essential for normal body functions. When the body does not receive adequate nutrients or receives them in excess, malnutrition occurs. Hence, malnutrition remains one of the major public health problems worldwide, particularly in developing countries. It affects people of all ages, but it is most common among infants, children, pregnant women, and elderly. So, in general, poor nutrition reduces body strength, delays recovery, and increases vulnerability to diseases. Hence, there is need to develop strategies for preventing malnutrition. Now, what is malnutrition? Malnutrition is a condition that develops when the body receives insufficient, excessive, or imbalanced amount of nutrients required for normal growth, development, and health. These nutrients include carbohydrates, fats, proteins, vitamins, minerals, water, and electrolytes. When there is inadequate intake of these nutrients, malnutrition may occur, or when the food quality itself is poor, or when there is a condition, disease, that prevent absorption of the nutrients. Therefore, malnutrition is caused by several interacting factors, which can be diet related, such as inadequate food intake, poor dietary diversity, wrong feeding practice, etc. Or it can be disease related, such as diseases like diarrhea, vomiting, malaria, measles, tuberculosis, and so on, that prevent absorption of nutrient or impair with the body metabolism. It can also be through social causes such as poverty and food insecurity, poor sanitation, low nutrient nutrition knowledge, poor access to health services, and so on. Now, based on its causes, malnutrition can be classified into three major categories. Category A is undernutrition, which occur when the body does not receive enough nutrients, leading to wasting, low weight for height, stunting, underweight, or protein energy malnutrition. It can also be as a result of deficiency or excess of vitamins and minerals. In this case, it is referred to as micronutrient malnutrition. There is also overnutrition, which occur as a result of excessive intake of nutrients. Taking the first category, which is undernutrition. Undernutrition occurs when the body does not receive adequate amount of nutrients. It generally presents in three major forms. The first category is called wasting. Wasting is a type of undernutrition which is generally referred to as low weight for height. That is to say, the child's weight is too low for his or her height. Hence, wasting is when the child or adult has very low weight compared with their height. It usually reflects recent or acute weight loss that is often linked to food shortage or recent illness. Hence, the common causes of wasting include severe diarrhea, vomiting, poor food intake, or when there is acute infection such as measles, malaria, or household food insecurity. For example, a child that develops diarrhea for several days may lose appetite, loses body fluid and nutrient, and will rapidly loses body weight, leading to wasting. Now, the second category of undernutrition is called stunting. Stunting, generally referred to as low height for age. That is, the child's height is too low for his or her age. So when a child is shorter than expected for their age, this condition is called stunting. Unlike wasting, stunting generally reflects long-term nutritional deprivation, which often begins during pregnancy or early childhood development. Stunting generally leads to reduced physical growth, delayed cognitive development, lower school performance, reduced productivity later in life, and so on. The third category of undernutrition is called underweight. Underweight is commonly referred to as low weight for age. That is to say, the child's weight is too low for his or her age. Undernutrition may generally reflect wasting or stunting or both cases. Now, undernutrition can be determined using anthropometric measurement. Each anthropometric measurement uses different comparison depending on the type of undernutrition being studied. For example, wasting, which is low weight for height, is determined by measuring both weight and height and comparing against the standard plot for weight and height. While stunting can be determined by measuring the height and comparing it with the normal height for the age scale. Underweight can be determined by measuring the weight and comparing it with the normal weight for age scale. Now, the last form of undernutrition is called protein energy malnutrition. This is a form of undernutrition that occurs when there is inadequate intake of protein and energy. In other words, protein energy malnutrition occurs when energy intake is inadequate, protein intake is inadequate, or when infection increases energy and protein needs, or when feeding is poor during illness or after weaning. So it is common among children in low-income countries due to factors such as starvation, chronic illness, severe poverty, and so on. There are only two major clinical forms of protein energy malnutrition. The first category is called marasmus, which is a severe malnutrition resulting from deficiency of both protein and energy. While the second category is called kwashiorkor, which is a severe form of malnutrition that is caused mainly by protein deficiency despite adequate calorie or energy intake. There is also marasmic kwashiorkor, which has features of both marasmus and kwashiorkor. Now, typical features of marasmus include severe wasting, old man face appearance, marked weight loss, prominent ribs, very thin arms and legs, loose wrinkled skin, but with no edema, and therefore the main recognition clue for marasmus is when there is severe wasting without edema. On the other hand, kwashiorkor typical features include one, edema, which can be swelling of the feet, legs, or face, or the abdomen. Another feature is sparse or discolored hair, flaky paint skin lesions, and enlarged liver. So in contrast to marasmus, the main recognition feature or clue for kwashiorkor is nutritional edema, especially swollen feet or legs. So here is a quick comparison between marasmus and kwashiorkor based on the features we listed in previous slides. The main deficiency for marasmus is lack of protein and energy intake, while for kwashiorkor the main deficiency is mainly due to lack of protein intake, often with sometimes with infection. So these are the other features include body weight, presence or absence of edema, appearance, skin changes, clinical risk. That is why it is advisable to never rely on body size alone, because edema can hide severe form of malnutrition. Moving to the second category of malnutrition, which is called micronutrient malnutrition. This is because it's a type of malnutrition that occurs when there is deficiency or excess intake of vitamins and minerals. Hence, it is generally referred to as micronutrient deficiency diseases. In fact, it can occur even when there is adequate intake of calorie. Now, since micronutrients are essential for many body functions, micronutrient malnutrition therefore affect several functions of the body, such as immunity, growth, vision, blood formation, brain development, and several other functions that vitamins and minerals impact with the body. Example of micronutrient deficiency is vitamin A deficiency diseases. Vitamin A is essential for vision and eye health. Hence, its deficiency generally leads to night blindness and xerophthalmia, which result in poor vision in dim light, dry eyes, bitter spot, and potentially permanent blindness. It is generally caused by inadequate intake of vitamin A-rich foods, fat malabsorption, prolonged malnutrition, or recurrent infection. So the prevention of this type of deficiency may include regular consumption of vitamin A rich nutrients such as carrots, dark green leafy vegetables, red palm oil, liver, eggs, fortified foods, and vitamin A supplementation where necessary. The second example is vitamin D deficiency. Vitamin D is generally essential for bone growth and maintenance. Hence, its deficiency causes rickets in children and osteomalacia in adults, leading to soft bones, bowed legs, bone pain, delayed growth, and skeletal deformities. Common causes of this include insufficient sunlight exposure, inadequate dietary intake, and malabsorption disorders. Therefore, prevention include adequate sunlight exposure, consumption of vitamin D rich foods such as fish, eggs, milk, fortified foods, or vitamin D supplementation. Now, the third example is vitamin C deficiency. Vitamin C is essential for immunity, skin integrity, and wound healing. Hence, its deficiency causes scurvy, which is characterized by bleeding gums, easy breathing, losing teeth, fatigue, and poor wound healing. It commonly results from low intake of fruits and vegetables, or when there is poor dietary diversity or excessive cooking that destroys vitamin C and prolong malnutrition. Therefore, prevention will include regular consumption of vitamin C rich nutrients such as citrus fruits, guava, mangoes, tomatoes, peppers, and other fresh fruits and vegetables. Now, another form of micronutrient deficiency disease is caused by iron deficiency. Iron is essential for blood formation and oxygen transportation. Hence, its deficiency generally causes iron deficiency anemia, characterized by fatigue, pallor, weaknesses, dizziness, reduced work capacity, uh, and formation of spoon-shaped nails. It commonly results from inadequate dietary iron intake, chronic blood loss, infections such as hookworm infection, uh, increased nutrient requirement during pregnancy, poor iron absorption, and so on. Therefore, prevention will include consuming iron-rich foods such as meat, fish, liver, beans, and dark green leafy vegetables, as well as using fortified foods, iron supplement, etc. The next category is iodine deficiency disease. Iodine deficiency disease is generally leads to goiter. Iodine is required for thyroid hormone production, normal and normal brain development. Therefore, its deficiency leads to goiter and other iodine deficiency disorders that may lead to enlargement of the thyroid gland, impaired growth, reduced cognitive development, and mental impairment, especially in children. Common causes of this deficiency include inadequate iodine intake, living in iodine deficient areas, and excessive consumption of goitrogenic foods in the absence of sufficient iodine. Therefore, prevention of this deficiency will involve regular use of iodized salt and consumption of iodine-rich foods such as seafood, dairy products, and eggs. Now, the last examples we'll look at is zinc deficiency. Zinc is generally crucial for growth, immunity, skin health, and wound healing. Hence, its deficiency causes zinc deficiency syndrome, characterized by growth retardation, poor immune function, delayed wound healing, hair loss, dermatitis, and impaired taste perception. It commonly occurs due to inadequate dietary intake of cereal-based diets with low zinc bioavailability, chronic diarrhea, malabsorption disorders, and increased requirement, especially during period of rapid growth. Therefore, prevention will include consuming zinc-rich foods such as meat, fish, poultry, eggs, milk, legumes, nut, fortified foods, and zinc supplements. Now, moving to the last category of malnutrition, which is called overnutrition, that generally result from excessive intake of nutrients. Common examples of this of its presentation include overweight. Overweight occurs when the body weight is higher than the recommended for a given height. It is generally associated with some risk factors such as excessive calorie intake, physical inactivity, high fat or high sugar diets, and so on. The second presentation is obesity. Obesity is a type of overnutrition manifestation which occur as a result of accumulation of excess body parts that may affect the general body health. Hence, it has several health consequences, such as increasing the risk of high blood pressure, diabetes, heart diseases, joint problems, and so on. The last category is hypervitaminosis, which is otherwise called vitamin toxicity, which occur when there is excess intake of vitamins beyond the body's need. Therefore, its possible side effects include possible manifestation include nausea and vomiting, headache, liver damage, bone pain, and other organ problems. In general, excess calorie leads to weight gain, which leads to metabolic stress, which will consequently lead to the development of non-communicable diseases. Hence, it is generally good, it is generally wise to take balanced nutrition. So good nutrition means balance. Too much of certain nutrients can be as harmful as taking little nutrients. In general, malnutrition affects the body in several forms, such as affecting the growth, leading to stunting, wasting, delayed puberty, low body weight. It can also affect the immune system of the body, leading to frequent infection and more severe illness. It can also affect brain development. It can affect wound healing. It can also lead to higher risk of death in severe cases of malnutrition. Now, let us look at the relationship between diseases and malnutrition. Diseases and malnutrition usually interact with each other to form what is called a vicious cycle. Diseases generally causes malnutrition because disease leads to poor food intake and loss of nutrients through reduction in appetite, vomiting, causing diarrhea, increase in nutrient loss, and general increase in energy requirement. On the other hand, malnutrition also causes diseases, as we have seen in previous slides. Malnutrition generally weakens the body and reduces resistance to diseases. In essence, malnutrition affects the immune system of the body, making the individual more susceptible to infections such as respiratory diseases, diarrheal diseases, measles, malaria, tuberculosis, and several other infections. That is to say, both diseases and malnutrition interact in a negative way, affecting growth and development of the body. This interaction establish what is called vicious cycle. In vicious cycle, diseases, infection or illness occur. When it occurs, it leads to poor nutrition. And when there is poor nutrition, the poor nutrition will lead to inadequate intake or loss of body nutrients. And this will lead to weak immunity, making the body more susceptible to infection. And ultimately, this will now lead to increase in the disease. So more diseases severity, risk of illness, and so on increases. And the cycle keeps on repeating itself as the diseases increases, poor nutrition, malnutrition increases, and more diseases result. Therefore, in order to break this cycle, good nutrition plus good health are essential, which will lead to healthy life. So diseases and malnutrition are interlinked, and they create what is called a vicious cycle. Improving nutrition and preventing or treating diseases can be used to break the vicious cycle. The second to the last objective of this presentation is diagnosis of malnutrition. Diagnosis of malnutrition generally aim at nutritional assessment. This include clinical assessment such as assessing weight loss, muscle wasting, edema, hair and skin changes, eye and mouth sign. It also includes the physical measurements, anthropometric measurement of weight, height and length, body mass index, gross chart interpretation, and so on. Generally, body mass index is equal to weight of the body divided by height in square meter. So it has a standard classification. Less than 18.5 body mass index indicate underweight, while 18.5 to 24.9 indicate normal gross, while 25.0 to 29.9 indicate overweight, while above 30, above or equal to 30 indicate obesity. There is also mid-upper arm circumference measurement. Mid-upper arm circumference measurement is usually useful for rapid screening of acute malnutrition. So it is commonly used in children and immunity nutrition programs. Most importantly, body mass index does not diagnose micronutrient deficiency and therefore should be interpreted with clinical findings. The last category is laboratory tests, such as hemoglobin to assess the level of ions, serum albumin, vitamin mineral assays, stool test for parasites, and so on. So best assessment generally combines history, examination, measurement, and laboratory evidence to determine malnutrition or to diagnose. So suitable control requires food, healthcare, sanitation, education, as well as special social protection. So as a recap of what we mentioned, preventing malnutrition is necessary, and it involves taking balanced meal such as the milk, clean water, breastfeeding, hand washing, immunization, as well as growth monitoring. With this, we come to the end of today's presentation, and thank you for listening.